Welcome. So my presentation is on medication-induced hyperkalemia in chronic kidney disease. So a little background on this topic. So hyperkalemia is a known side effect of the drug interaction of trimethoprim sulfamethoxazole and the ACE and ARB medications. It puts patients at higher risk of hyperkalemia when taking these simultaneously. Why do you ask? So trimethoprim functions in the distal nephron as a mimic of a potassium-sparing diuretic. It does this through the blockade of the ENaC channel, which I can go into further. However, it disrupts the voltage or the gradient between sodium and potassium, and therefore blocks the potassium secretion and excretion into the urine. The ARB and the ACE downregulate the renin-angiotensin-aldosterone system, which also puts patients at risk of hyperkalemia. The reason this case is significant is because of the incidence of use of these medications, especially in our comorbid patients. So I thought it was something to highlight and to expound upon. So regarding this patient's history, as a 6-year-old female, history of diabetes, hypertension, CKD stage 3, and hidradenitis suppurativa, also known as HS. She was taking Bactrim for 4 weeks prior to presentation to the hospital. She was recommended to come by her primary care physician due to a BMP value outside of the hospital in the 7s, potassium of 7s. So when she arrived, she was noticeably tachypnic, potassium value as 7.4. We admitted her. She was with us for a few days. She received the appropriate medication to reduce and to normalize her elevated potassium value. Nephrology was consulted. Felt confident in this case that this was a case of medication-induced hyperkalemia. Differentials at the time included acute interstitial nephritis as well as type 4 renal tubular acidosis. Her clinical picture did not fit acute interstitial nephritis, and we collected urine electrolytes that did not correlate to RTA type 4. So the patient was discharged. We informed her to discontinue the use of her ARB while taking Bactrim. Also, we did discontinue Bactrim and instructed her to follow up with her primary care physician. We were able to substitute her ARB with hydrochlorothiazide diuretic and instructed her to continue to follow her potassium value closely. So as I said, not a case that is entirely complex when you're considering the medical conditions and diseases that we study. However, given the incidence of the use of these medications, how commonly they're prescribed, I think it's something to highlight when we're choosing antibiotic therapy as well as their interactions with other medications, including the ACE or ARB antihypertensives. Thank you.